When do they take their license? They can take their license anytime, right? There's your license.
Encouraging them to do that soon.
But it's a big class. It is 29. It's 29. I still have 20 in my house. 15 million hired all of them.
Off the bat. No,
I think every
last year I hired two.
at every
There's an echo. Is that
It's the screen. So you're okay.
okay?
just to get the.
I only did 3.
In hospital, I think I did, I did 10. Almost 10. Then I did 20 nursing, and then am I ready?
Half a day and good morning. Welcome to the Guam Nurses Association 70th Anniversary and Recognition and Awards Ceremony. My name is Isa Grace Santos, the GNA Treasurer, and I'll also be your MC today. Before we begin today's event, I'd like to give a special welcome to our dignitaries. Governor Lourdes A. Leon Guerrero, Lieutenant Governor Joshua F. Tenorio, Speaker Therese M. Terlahi, the 21-22 GNA officers and board members, Rose Greeno, President, Suzanne Lebaton, Vice President, Christine Cristobal, Secretary. Our directors at large, Veronica Vicky Alave, Elizabeth Santos, Francis Nickdell, Kyle Arevalo, Dan Michael Romulo, Gladys Almonte, our Executive Director, Evangeline Allen, and Margarita Gay. I'd like to also acknowledge our GNA Recognition and Awards Committee members, Aguinilda Antolin and Glorianne Sefri. Our GNA Nurse of the Year nominees and their guest, Dr. Teofila Cruz, Dorothy Duenas, Philip John Kalalu, Dr. Brian Banso, and Lillian Perez Posadas. Their Nurse of the Year nominators, Dean Dr. Margaret Hattori Uchima, Dean Pilar Pangilinan, Jocelyn Zamora, Jennifer Cruz, and Christine Tucaro. Awards coordinator and the judges, Winnie Butler, Dr. Yolanda Carrera, Frank Camacho, Kathy Rivera Castro, Dr. Hyung Jung Ham, and Lillian Pojas. Additionally, joining us virtually on Facebook Live, I'd like to welcome the members of the Guam Nurses Association and that of the 36th Guam Legislature. Vice Speaker Tina Muñoz Barnes, Senator Sabina Perez, Senator Anthony Tony Ada, Senator Tello Taitigui, and Senator Joanne Brown. We are extremely honored to have all of you joining us today, including our family and friends who are watching our live stream and supporting our nominees virtually. At this time, I'd like to call upon GNA President Rose Greeno for some welcoming remarks.
our Magahaga, and our chief nurse, Governor Lulian Guerrero. Segundo na Magalahi, so I'm trying to pronounce it right. Justin Aryu, Speaker Therese Terlahi, members of the 36th Guam Legislature, my dear nursing colleagues, special guests, family and friends who are present here and joining us via Zoom and watching us via live stream. Good morning and welcome to the Guam Nurses Association 70th Awards and Recognition Ceremony. Before I move on, first, I really want to recognize and thank the Governor's Office and staff for hosting us today. Crystal, Jen, Lisa, Chris, and Kathy, and our technical support staff, thank you so much for making this happen. We're nurses, we're very flexible. You guys did a good job. All right. This year's Nurses Month theme, Nurse Makes a Difference, recognizes the vital role of nurses in the healthcare system and its positive impact to the lives of patients and community. Nurses makes a difference every day, whether it be at bedside, providing acute and critical care, on the field, screening, testing, and contact tracing, at patients' home, providing skilled nursing care and comfort care for the dying, at the clinic, providing vaccination, preventive care, and counseling, at the school, caring for our students, and nurturing and training our future nurses, in the boardroom and behind the desk, creating policies, leading, and advocating for safety and well-being of patients and community. Nurses continue to make a meaningful impact on the lives of every patient, every client, every day. We honor and thank all nurses for the many physical, mental, and emotional sacrifices you or we continually make. I stand proud and walk and work alongside with you, my dear nursing colleagues. At this moment, I would like to ask my fellow nurses to join me to recognize the difference you have made by giving yourself a hug. So cross your arm and your chest, with your hands resting in your shoulder, even the one in the Zoom and via live stream, all my nursing colleagues, and tightly squeeze and tell yourself, thank you, you did a good job, God loves you. I would like also to ask the family member watching and listening right now, and friends and significant other, to turn around and give your favorite nurse that big hug and pat in the shoulder and say thank you. Thank you. All right. Thank you. Thank you. Thank you. Of course, our highlight for today's ceremony is the awarding of the Nurse of the Year award. I'm sure everyone is excited, of course, of the few more minutes of long wait. We have 5 nominees who made a positive impact in the nursing profession in our community. Congratulations to all our nominees, and of course, to the nominator that spent a lot of time working on their nomination packet. Special thank you to our awards coordinator and judges for your time and support. This is an extraordinary celebration during these unprecedented times, because even today, during our awards, we get tested. We have so much to be grateful for. As nurses, we have to be grateful for every day. So my sincere appreciation to all our community partners and support. But once again, good morning and welcome to our celebration.
Thank you, Rose, for your inspiring message and for sharing your virtual hugs with us. Now, I would like to welcome today's keynote speaker, our very own Magahaga and fellow nurse, the Honorary Governor Lourdes Lou Leon Guerrero.
Thank you very much. Before I begin, I would just like to say that as I sat up here and looked around, I couldn't be the most proudest public official in the island of Guam for being with you and for being there for us, for our community, for saving the lives of our people when we so much needed that care. I want to say thank you from the bottom of my heart. And all of you make Guam proud, and all of you especially make me proud. And when I have had to make critical, hard decisions, I'll tell you how I make those critical, hard decisions using my critical thinking. And we all know what that is about. And if it wasn't for my nursing education, my nursing experience, and you that give me the energy as a nurse to continue on with those hard decisions, I don't think we would be where we are today. So I just want to thank all of you. I want to say Hafaday and Sidus Masi for inviting me and my Lieutenant Governor, our Lieutenant Governor, who has always been at my side in making those hard decisions and will continue to be the support of our administration. We are very, very honored to be here in this Guam Nurses Association Year Award ceremony. This year's award recipient must have been an extremely difficult one to decide upon. Great nominees up here. Because every nurse on Guam attained, in my book, rock star status during the pandemic. Guam would not be where we are today with regard to recovering from the pandemic without each of you. I would not have been, as I said, able to do what I did as governor during this pandemic had it not been for each of you. Performing your various roles as nurses in our hospitals, in our clinics, in our universities, in our educational institutions, or out in the community. Josh and I owe each of you a debt of gratitude, as does each and every member of our community. Whether you worked in the hospital's COVID unit or anywhere in GMH or GRMC, or whether you are a public health nurse who sweated in protective gear for 8 to 10 hours a day under a tent somewhere in Guam conducting drive-through testing for COVID cases, or whether you were giving people shots at the University of Guam Fieldhouse or another location, or whether you worked in a clinic or as a school nurse, many of whom were detailed to GMH or public health early on in this pandemic, or whether you worked in home health care, still going to people's homes because your patients needed to be cared for, or whether you worked in a quarantine facility dealing with people frustrated that they had to be shut in a hotel room for 2 weeks, or whether you were a retiree and came back to help with our community. You were all exposed to this virus through your work. Some of you stayed away from your families for extended periods so as not to expose them. Some of you suffered through the virus and thankfully recovered. Tragically, we lost one of our colleagues. But through it all, you did your best and you persevered, often though working conditions that would have caused others to just throw in the towel. I saw many of you in action as I went out there, at the testing sites, at the vaccination sites, at the call center site, at GMH, at GRMC, and in other places. And you were all very gracious to our people. You tried your best to put people at ease while you were shoving a cotton swab up their nose and practically into their brain, or sticking a needle into their arm. Those of you who worked in our hospitals were a lifeline to families with a loved one in your care. It was you that held the hand of the dying COVID patient. It was you day in and day out, night in and night out, who cared for COVID patients or other patients in other units. At times, you brought patients back from the brink of death because of your skills and your knowledge of how the human body works or isn't working. You are the ones who summoned the doctors, often telling them what the patient needed or insisting that a certain procedure needed to happen. You Zoomed for family members so they could see their loved ones. You held patients' hands so they did not die alone because their families couldn't be there because of this horrible virus. Out in the community, you counseled people who are sick. You recognized and reported abuse. You helped people to become better, often in more ways than just with regard to their health. Those of you who are administrators had to invent protocols on the fly in order to protect as many people as possible, including your staff. Through so many instances, each and every one of you stood out as a hero. People called you heroes, but you didn't choose nursing because you wanted accolades and titles, nor did you ever imagine that nursing would turn into a post-apocalyptic survival skill. Most of you became nurses because of a desire to help people. I became a nurse because I cared for people, and I wanted to nurture people through sick times and in better times so they can continue being healthy, productive, and providing for their family. But you soon learn that nursing is not like any other professions. Nursing is not just what you do every day when you put on scrubs and walk through the doors of hospital, clinic, school, or wherever. Nursing is who you are. Helping others is a part of your being. They give us the title nurse because, as the saying goes, they can't really call us miracle workers, even though that is what we often do. We work miracles. One of the things we often hear from nurses in other communities in the States is how resourceful nurses from Guam are. This pandemic was truly evidence of your training and your ingenuity. I heard stories of how you MacGyvered equipment when you ran out of something needed for patient care, how you made situations work with what you had in order to keep your patients alive. That takes resourcefulness, but it also takes knowledge. Guam nurses know what they are doing. You are proof of that. You touch people's lives. Never mind that most of us nurses will touch just about anything as long as we have gloves on. Seriously though, whoever is acknowledged as the year's Nurse of the Year, know that you are accepting this award on behalf of all of your fellow nurses on Guam. Again, we would not be as far along on our record to recovery from this pandemic had it not been for each and every one of you. I truly believe that from the bottom of my heart. So congratulations to all of you for an amazing job in saving our community, and congratulations to the nurse who represents all of you as Nurse of the Year. God bless you, and may He protect you as you protect and heal the people of our island. May your scrubs be comfy, your coffee be strong, and your Mondays be short. Sidzus Maasi, and you certainly do make a difference for our people of Guam. Thank you.
Sidiwas Maasi, Governor. Next, I'd like to now call upon Speaker Therese Terlahi for the resolution presentation.
Good morning, everyone. I saw many of you tearing up as the governor recalled everything that you've been through. And there's probably more, but she did a very excellent accounting of everything that you nurses have gone through out of dedication, out of use of your skills, high skills, and out of love. I know that. And I just want to say we are forever grateful to you, to each of you and your families for all that you have done. And thank you, Governor, for recounting all of that. We will never forget all that you have done. Of course, we're here to celebrate today, and a wonderful celebration to honor all the nurses of the Guam Nurses Association, to honor these nominees here who have been selected this year. And it's been my pleasure to attend several ceremonies where they recognize every year, and I think the Guam Nurses Association deserves accolades for all the work that they do. They are true leaders. I always say this, they have led in policy, and I want to encourage you to continue to do that. Advocacy for patients, advocacy for nursing work conditions, advocacy for the people of Guam. And you've also led in taking care of each other. And I just want to point out some of the things that we point out in our resolution that you have coordinated this month. And I know you've talked about this before, but I just think you've done such a good job. I've seen it all over social media. And so I hope that everyone continues to participate. It's where you did your weekly social media challenges, including the self-care challenge. Self-care. We can't take care of you after you've taken such good care of us. And so I'm so glad that there's some focus on taking care of yourselves, and I hope you're able to do that, to inspire and encourage others to commit to protecting and caring for one's mental health, physical well-being. The Nurse Recognition Challenge, where individuals were able to acknowledge nurse heroes, innovators, and leaders by posting about their work through a photo or a story. A professional development with focus on nursing, scope and standards of practice, community engagement to help promote nurses' invaluable contributions by engaging virtually or in person with your community. I've seen you also attended the Nurses' Blessing held at various places of worship. I've seen the pictures of the cakes delivered throughout Guam, and it's for us watching, it's so thrilling to see the creativity and just to see all the nurses gathered together in groups, and so we have finally a chance to celebrate a little bit. The mini virtual continuing education series, the virtual 5K run walk, and this is to impact about 1,500 nurses on island who have continuously worked hard to provide quality health care to the people of Guam. Even before the start of the COVID-19 pandemic, and the declaration of the public health emergency, and to reinforce the benefits of having dedicated healthcare workers in the community. You highlight the contributions they have made to prevent further spread of COVID-19 while taking care of the people of Guam. And we've all heard the stories, as the governor described, of how you have improvised and how you have been creative and how you have made it work despite everything else going on, and how you have shown that compassion, as she described, holding the hands, live streaming for the families. I am very proud as well that we have nurses like this on Guam, and we have been told we have the best nurses, and I believe that very much, and I have seen it, and we've all felt it. So again, thank you so much for your love. On behalf of the 36th Guam Legislature, we are presenting this resolution to the Guam Nurses Association. We are also congratulating these 4 nominees, these stellar nominees, for being nominated, and we are, of course, congratulating the one who is selected on behalf of all the nurses of Guam. If I could just say their names out loud. I know they were announced earlier, but I just want to say that again. Dr. Teofila Scholing Perez Cruz, Lord Dorothy Lau M. Duenas, Lillian Perez Posada. She's probably our biggest rock star at this point because she's also a favorite on the media. We love to hear from her. And I'm sorry. Brian Bansil and Philip John Kalalo. Situs Masi to all those who nominated them, who have taken the time to write out everything that they have contributed and their dedication, about their dedication, and to the families who support these nominees. Situs Masi, on behalf of the people of Guam. Thank you.
Thank you.
Thank you, Speaker Terlahi. And now I'd like to call upon our Governor and GNA President Rose Greeno to present the certificates of recognition to the awards coordinator and judges. Kindly come forward when your name is called and remain in front for a photo. Winifred Winnie Butler, Awards Coordinator and Executive Director of the Guam Diabetes Association. Kathy Rivera Castro, Awards Judge and Community Advocate. Dr. Hyun Jong Ham, Awards Judge and Professor at the University of Guam, Division of English and Applied Linguistics. Unable to join us today, we have Dr. Yolanda Carrera, Awards Judge and Pediatrician at Dr. Carrera's Clinic and Pediatric Hospitalist at Guam Memorial Hospital. Joining us virtually, we have Frank Camacho, Awards Judge and Executive Vice President and Chief Operating Officer at Personal Finance Center. And lastly, Lillian Pojas, Awards Judge and Registered Nurse at Guam Memorial Hospital, Utilization Department. Thank you all for your time and dedication in recognizing nursing excellence. Today's event would not be possible without the chairperson of the Recognition and Awards Committee, Suzanne Lobaton. Will you please come forward to do the honors of presenting this year's Nurse of the Year nominees?
All right. Buenas and hafa day, everyone. Governor Lou Leon Guerrero, Lieutenant Governor Joshua Tenorio, Speaker Therese Terlahi, our distinguished guests, GNA members, family, friends joining us here and virtually this morning. It is truly an honor and privilege for me to introduce to you our 5 nominees for the 2021 Guam Nurses Association Nurse of the Year Award. Our first nominee is Brian Bansil, Doctor of Nursing Practice, Certified Acute Care Nurse Practitioner in Adult Gerontology, and Critical Care Registered Nurse. Dr. Brian Bansil is an outstanding nurse practitioner. He provides quality health care to patients in the hospital and office setting. Over the course of his career, he has shown himself as energetic, meticulous, and dependable. He is best represented by his consummate commitment to self-improvement as he quickly rose through the ranks, taking on more responsibility as the ICU supervisor and hospital nursing supervisor at the Guam Regional Medical City. Dr. Bansil's vast clinical experience as a bedside nurse, charge nurse, and exposure and house supervisor have given him a tremendous breadth and depth of exposure to the most challenging patients. He offers a wealth of knowledge and support to his fellow nurses. His dedication to his profession and his community make him a caring, conscientious, and highly effective clinical nurse provider and leader. Dr. Bansil embodies passion for the nursing profession, as is demonstrated in his fervent dedication to serve the most vulnerable as a critical care nurse and now as an advanced nurse practitioner. He is an inspiration for all. Dr. Bansil couldn't join us this morning physically, but he is joining us virtually. So I'd like to ask his nominator, Ms. Jen Cruz, to please kindly come forward and stand front and center to receive the certificate of recognition on Dr. Bansil's behalf. So Governor and Rose. Shoot, sorry.
Brian is alive right now, he's watching.
Congratulations on your nomination, Dr. Brian Bansil. Our next nominee is Philip John Kalalo, Master of Science in Nursing, Registered Nurse. Mr. Philip John Kalalo is a clinical instructor at the University of Guam and wound care supervisor at the Guam Memorial Hospital. During the pandemic, he stepped up as a COVID-19 nursing supervisor. He coordinated COVID-19 admissions and led nursing staff in providing the safest quality care for their COVID-19 patients. Faced by many challenges in the hospital setting amidst the pandemic, his valiant efforts to encourage and empower others is commendable. As a charge nurse, Mr. Kalalo's leadership skills are outstanding. He communicates thoroughly with providers and staff. To further his professional development, he obtained his certification as a wound care nurse specialist. His expertise in this area is invaluable and a great asset to his organization and the population that they serve. Mr. Kalalo developed wound care policies and protocols, including one for the use of the wound vacuum, training all adult units nursing staff, including those in the skilled nursing facility. He is a member of the American Board of Wound Management and Omicron Delta Nursing Honor Society, Sigma Theta Tau International. Mr. Philip John Kalalo, kindly come forward and stand front and center to receive your certificate of recognition. Our next nominee is Teofila Scholing Perez Cruz, Doctor of Philosophy and registered nurse. Dr. Teofila Scholing Perez Cruz has long been a dedicated nursing educator, leader, and more recently, a researcher in the area of cancer and health disparities. In the wake of the COVID-19 pandemic, she came out of retirement and volunteered to lead COVID-19 response efforts to serve the island of Guam during a time of extreme crisis. A true hero during the pandemic, her achievements exemplify the best traits of the nursing profession, and especially of nursing leadership. She has been an exceptional role model for the University of Guam health profession students. Her significant impact during the pandemic is only a fraction of the countless contributions she has made for the island's nursing community. She authored more than a dozen publications and served in numerous professional capacities within Guam's healthcare community for the last 40 years. Additionally, she established the Sally Suda Education, Research, and Service Office at the University of Guam and currently serves as the Executive Director of the American Pacific Nursing Leaders Council. Through these two endeavors, she has strengthened nursing education in the Micronesian region. Dr. Cruz is a pillar of Guam's nursing community. Dr. Teofila Cruz, kindly come forward and stand front and center to receive your certificate of recognition. Congratulations on your nomination, Dr. Cruz. Our next nominee is Ms. Dorothy Lou M. Duenas, Master of Science in Nursing and registered nurse. Mrs. Dorothy Lou Duenas has made significant contributions for the nursing profession and in the delivery of quality nursing care for the island of Guam. Through her innovative ideas and demonstration of consistent advocacy within the nursing field, she is an inspiring role model. One of her major accomplishments is the implementation of the Associate of Science in Practical Nursing program at the Guam Community College. Through the ASPN program, she provides career guidance and education in the nursing field to students from Guam and the Pacific region who aspire to become practical nurses. Another outstanding accomplishment is her implementation of the paramedic program for 33 Guam Fire Department personnel. Mrs. Duenas serves as the administrator for the Nursing and Allied Health Department at the Guam Community College. In her role, she provided sound leadership in navigating a critical program midway through the unprecedented challenges presented by the COVID-19 pandemic, resulting in 19 ASPN graduates and 16 currently enrolled. Her tireless efforts to ensure faculty and student educational needs are met is credited to her leadership and management style of shared responsibility with her teaching faculty. She is a staunch believer that it takes a team to get things done. Her love for nursing and her community are further displayed through volunteer work at various healthcare outreaches. Mrs. Dorothy Duenas, kindly come forward and stand front and center to receive your certificate of recognition. Congratulations on your nomination, Mrs. Duenas. And last but definitely not least, our next nominee is Mrs. Lillian Perez Posadas. Mrs. Lillian Perez Posadas serves as the Guam Memorial Hospital Authority Hospital Administrator and Chief Executive Officer. She has contributed to the nursing profession over her career and most significantly in the past year and a half during the course of the COVID-19 pandemic. She has made significant and lasting impacts in the quality of healthcare delivery for the island of Guam during the pandemic crisis. Her valuable contributions include the establishment of COVID-19 contact and response protocols and the management of the GMH COVID-19 call center. Mrs. Perez Posadas' unwavering, tireless efforts during the pandemic is the epitome of exceptional nursing leadership, commitment, and dedication. With her calm manner, strong leadership skills, and rich experiences at GMH, the Guam Department of Public Health and Social Services, and the University of Guam, she flawlessly provided valuable counsel to the nursing workforce during a time of crisis. Mrs. Perez Posadas has worked as an RN for 49 years in a wide range of leadership positions. She is a staunch advocate and resource for all nurses and the nursing profession on Guam. Her contributions in nursing and health disparity research also provided valuable impact to the improvement of health care for our island community. Mrs. Lillian Perez Posadas, kindly come forward and stand front and center to receive your certificate of recognition. Now I would like to call the Governor Rose and also Lieutenant Governor Joshua Tenorio up front to share in the distinction of awarding the Nurse of the Year winner together. Drum roll. Can I get a drum roll? All right. And, okay. Now it is my greatest honor and privilege to introduce to you our 2021 GNA Nurse of the Year, Dr. Teofila Scholing Perez Cruz. Congratulations, Teo.
Say something? Sure. Yeah. To you.
I'm basically a shy person and don't say much at all, and I think a lot of people can validate that I really don't say too much. However, I'd like to thank my sponsor or my nominator, none other than the infamous Margaret Hattori Uchima, from the University of Guam. I'm actually speechless. I didn't think, I told myself I needed to go here because I was nominated before and I didn't attend because of some other reason, and I said, I gotta go. I really didn't expect it. I know that I don't even know who the nominees were. And so this is really an honor and a privilege to represent the nursing team here in Guam. We are awesome. You are awesome. The education is fantastic. We're looking, I believe, for another 100% passage rate for NCLEX. Nursing has gotten me in various capacity, from being a staff nurse, establishing the hemodialysis unit here in Guam, being probably one of the first Chamorro who probably worked at MCM, with a Korean institution. And I always envy people that get educated. I've gotten my education through a lot of hardship. I left my family when my kids were still very young for a year to go to get my graduate degree, primarily because I felt it was very important. My husband, who has supported me he's listening to me probably, and pushing me, but he's been just a rock in my life. My family, my daughter here, I think most of you know that we've been mistaken so many times in utmost conditions. And it was, even to just last week, I was negotiating, or the past month, negotiating for an MOA with Hawaii and DLS here. And my name has been said to be her, or her name to be me is like constant. I believe I amended a draft like 10 times, just changing the name. That, oh, this is meant to be that, or this is meant to be that one. But it's very nice, because I love my daughter. Thank you. I thank my family. Thank you for your support. My nursing colleagues, again, you guys are awesome. As you can see, I'm going all around in circles because I'm really not prepared to say anything. I'm pretty much a very, very quiet person. Thank you.
Thank you.
Congratulations again, Dr. Teal Cruz, our Nurse of the Year, and to this year's nominees. You all have made a difference and continue to make a difference every day here on our island home and within our communities. To commemorate all nurses near and far, please join us in enjoying an appreciation song brought to us by our very own Joe Guam. It is my pleasure to introduce his song titled Day by Day.
I'm Joe Guam, and I'm sitting right here on my front porch on the island of Guam, just hoping that all of you guys out there hanging in there during this challenging time. My wife, my daughter, and I, we wrote this song, and we wanted to share it with you guys, just in hopes that it'll bring some good vibes and positive spirit, you know? Here's a song called Day by Day, everybody. We hope you enjoy it. Times are changing, things are stranging, we are so confused. Lives matter, but some are forced to choose. Keep your head up, pull your heart out. Yeah, we gotta believe that if we stand together, we'll make it through anything. Be okay if we're living for each other. Take it day by day.
Siduos Maasi Joe Guam for that beautiful song. Lastly, for the closing remarks, I would like to call upon the Honorable Lieutenant Governor Joshua Tenorio.
Thank you very much. I was just, as I was going through the ceremony today, and I was thinking what to say, I decided that one of my best new roles that I've had, I guess since 2017 when we start getting together, is I think my favorite role is I'm a nurse collaborator, is what I think I am. Because I do collaborate a lot with the governor, but lately I've been collaborating a lot with Margaret over there, with homelessness, with all sorts of things. And of course, Lillian at the hospital and Lori at Public Health, even Julietta over there at DOA. I think I've been taking a course. Maybe I'll try and get continuing education credits for all the things that I'm learning from these great nurse leaders. I also was thinking that Dr. Cruz, I really do think that your late husband, Dr. Jose Cruz, I feel that he's smiling down on you with so much pride and likely so much gratitude for the partnership that you had. And I was thinking back to when we were here in this room when the governor and I were paying tribute to him and thanking your family for the service that he gave to the government of Guam and to the children of Guam. And so I want to thank you for coming out of retirement. I don't really think you did retire because I've heard that maybe retirement was a financial transaction because I don't think that you stopped working. But you didn't really have to step back into the stovetop, I guess, the firing range, if you will, to help address gaps that were created because of the pandemic and the need to be responsive, and for you and Dr. Hattori to make the University of Guam into a first responder in the pandemic, and even paving the way for Guam Community College to be a first responder and DOE to be a first responder. I think it's just amazing the work that you have. And I did hear, of course, that they call your daughter T.O. Jr. I know that people refer to her that way. I also want to thank Lillian. Thank you also for leaving a great, comfortable job where you can fly unlimited anywhere in the world. Your patient base is pretty healthy, right? And getting into this latest role at the hospital. I think it's just awesome that a nurse is the administrator of Guam Memorial Hospital, and a lot of people say that it's made such a big difference in improving patient care. And thank you also for getting out of your second or third career to come back into your first career. Dr. Bansal, who is listening, thank you too for being and setting a good, excellent standard. I've been seeing how many more nurse practitioners that are local have been getting into the workforce and inspiring other nurses to consider going back and getting more student debt and getting more credentials to be excellent. I think that's awesome. And Philip, thank you also for not only your role at the hospital, but also your role in mentoring the nurses that are coming up and wanting to get into this profession. 70 years, right, of nursing. This organization, the College of Guam started a nursing program, and now it is, the School of Nursing is so excellent, and it has a lot to do with the personnel, the faculty that are choosing to take that additional time to share their knowledge, but also to encourage and identify talent. And to you, Dorothy, the program that you and Mary Okada, I guess she's going to be another nurse collaborator, to help, really try and improve I know that there's been challenges with the associates program over there that you've been helping to improve, but you really help connect a longstanding thing that the governor had been thinking about since she was a senator, trying to establish this paramedic program and seeing the response from the firemen that are willing to, take this on additionally to what they're doing in the pandemic response. This couldn't have happened, and the result of what you're doing really is moving us into a much more responsive health system, right? I always say the firemen, the nurses are big fans of the firemen. They understand what they're doing, and there's a confluence there. So it's awesome that you are at the heart of getting that program into a reality. That's one of the first things that the governor and I talked about even during our campaign. That's one of the visions that we had. So, ladies and gentlemen, these are all change agents in Guam. And as the speaker was saying, thank you for getting involved in public policy. It is so much needed. You can see how public policy improves and becomes so effective when you have nurses and nurse leaders that are participating in that. And then the last thing I'll just say is this. There's a big effort that the governor is leading right now, really addressing the nursing profession, trying to make sure that we use this opportunity, and I know the speaker joins in this also because this is part of her work at the legislature, is to making sure that we find the right strategy to keep our nurses here, making sure that they are recognized and compensated the way that they should be. And what better way of getting this done at the time when the entire population can be grateful and can recognize that the nurses of Guam that saved our island from a horrible pandemic, and now will be leading our island into an excellent recovery. So congratulations. I'm so proud, and Dr. Cruz, thank you very much. Congratulations for everything that you do, and please continue to work. Don't retire yet. Thank you.
Thank you, Lieutenant Governor. This concludes today's ceremony. Please join us afterwards for group photos, light refreshments, and in congratulating our GNA Nurse of the Year nominees and our winner. Be on the lookout for an upcoming GNA virtual 5K fun, run, and walk. More information will be posted on our Facebook page and on Instagram. Thank you so much for coming. Stay safe, everybody, and have a great weekend.